Hey, John, in your book, Medical Evidence, Chapter 16, there's a lot of references to the neck injuries. I know that we've been representing a lot of people with catastrophic injuries to the neck where they've ultimately ended up with a cervical fusion. Can you help us understand both the anatomy and what it means to have a cervical fusion?
So, Mark, what we're looking at here, and again, a lot of these diagrams are also in the book, but when we look at the neck, what we're looking at here is the head is on the top. We're looking at a side view of the what's called the cervical spine. You can see the different colors here. The yellow represents the nerves coming out of the neck. This represents the spinal cord as it passes down into the canal. And then the front here, what we can see are the vertebral bodies and then the discs. The discs are often the areas that are the kind of the weak link when we talk about our clients and the injuries they sustained. And a common mechanism that we see with our clients is something called a whiplash injury, where the neck actually whips back and forth. When that happens, that puts a lot of pressure on the intervertebral discs or the cushioning between where our neck moves back and forth. If the force is so significant, what can happen is those discs can kind of push out of place. When they push out of place, they then can put pressure on the nerves, and our clients can start to develop what are called radicular symptoms, which means they start to feel pain, numbness, or tingling down the arm, or they can actually get weakness. When it gets to that certain point where the damage is going to be too much, if it's left alone, then what happens is a lot of our clients will undergo what's called a cervical fusion. And a cervical fusion basically means you're removing a part of the disc and then putting some bony material in between and some plates and screws to hold that together. And that area now will no longer move, but will also no longer put pressure on the nerves.
What is the function of those discs in between the different vertebrae?
So one of the ways you can think about it is as we move our neck back and forth, there's motion between the bones. So they're almost like joints in between there. But because the spine is a weight-bearing area of our body, from top to bottom, the discs also serve as shock absorbers inside the spine and inside the body.
What I've recognized is that some people end up with a fusion of just one level of those discs. And then over time, they end up having to go back in and get another level of the discs fused. Could you please explain to us why that happens?
Yeah, that's a great question, Mark, because what happens is when you fuse one level, all right, the adjacent parts of the discs start to experience more stress. Just like if I was to fuse my elbow, now the wrist and my shoulder are now going to have to do more work. Same thing happens with that disc. And eventually what happens when there's more forces that are spread out to the adjacent or the next levels, those start to wear out. So that's why eventually some people who have one level disc will later on need another fusion at an adjacent level.
I'd imagine that the fusion is on the extreme side of how to treat a neck injury. What other types of interventions are available for people if they don't want to go so far as to get a cervical fusion?
A lot of that is really dictated by the amount of pressure on the nerve. Okay, so there's a spectrum of pressure on the nerve where it's causing permanent damage, and that's where you really can't wait a long time before some kind of surgical intervention is needed. But when there's just a little bit of pressure on the nerve and it's causing a little bit of tingling, you can start out with some non-surgical or non-operative types of options. Those include things like anti-inflammatories, physical therapy, water therapy. But if the pressure becomes more prolonged or more severe where that nerve is really getting pinched, then you start to lose those options and you start to have to think about the surgical options.
At any point in time, does it make sense to try to kill the nerve roots to dull the sensation?
So what we're seeing here are these yellow kind of bigger nerve roots, but there are also smaller little branches that can contribute pain and the experience of pain in someone's body. So there are things like ablations and there are things like nerve root injections where you can kind of do little injections to make that area numb and have less inflammation.
How long does that last for?
It depends on the extent of the inflammation. You can think of inflammation like a fire, right? So inflammation comes the root word flame. If the fire is small enough to where the injection can put out that fire, sometimes those symptoms, they can go away for quite a while. But if the fire starts to come back again, or the fire is too big, sometimes the injection won't work.
Okay, thanks so much for sharing.
You're welcome.